So yeah, that's the next question for discussion right here. Mr. Parker, who is admitted with the diagnosis of severe depression, has been on imipramine. I believe all of you know that's an antidepressant, right? Yeah, it's an antidepressant. The one of the tricyclic, right? It's one of the tricyclic antidepressants for the past 2 weeks. His history also indicates hips replacement 2 months ago with a limited mobility. During morning rounds, he reports difficulty voiding for the last couple of days. The initial action of the nurse would be, now we were just talking, identifying the stem, right? What is the stem in this question? So this question has several different parts or several different distractors, we can say. What's the actual stem in this situation? Yeah, again, there is severe depression on imipramine, hip replacement, limited mobility, and then difficulty voiding. So what's the stem in this situation? So anyone who read this carefully, you will understand the stem is difficulty voiding regardless of the reason. Now patient has difficulty voiding. So that's a stem. So we identify the stem. Now what do we do? What action is a priority for this patient? The options we have: option 1, investigate for any signs of urinary retention. Option B, option 2, yeah, encourage him to stand up near the bed to facilitate voiding. Option 3, notify the MD of possible adverse response to imipramine. Option 4, identify any need for indwelling catheter. So what's the priority here? Now, let's go back to the question once more. The situation is the patient said, okay, patient cannot void, right? Patient cannot void. Now, patient said patient cannot void. That is, we can say, patient cannot void. That's a subjective statement, right? I can't void. That is subjective statement. Now, question: when patient says I can't void, can we call the MD right away? No, we can't. Remember, okay, that's another principle I want to say at this time, side by side. I want to say that that is probably what we call as passing the buck. Now, you will see this in a lot of questions. Passing the buck is wrong in NCLEX. Option saying to pass the buck, I mean, passing our responsibility to somebody else. That is wrong in NCLEX, as you will see in unlimited situations. So that's wrong. So we cannot call the doctor. We need to do something from our end before we call the doctor. So we can say, okay, option 3 is out. Now, patient said, I can't void. Should we just make the patient stand up right away? No, because we need to check the patient. Option 2 is out. Okay, we need to check the patient. We are left with the option 1 and 4. Option 1, investigate for any signs of urinary retention, versus option 4, identify any need of indwelling catheter. Now, they both are assessment, but again, first we need to validate what the patient said. Right? Patient said, I can't void, that is subjective. We need to validate that objectively by assessing the patient. That's what option 1 is. We can observe the suprapubic region for distension, and also we can percuss the bladder to see if there is dullness. This is the ways how we can check to see if the patient's bladder is full before we call the doctor, and nothing else. So therefore, our answer here is investigate for any signs of urinary retention.